Okay, so today we'll discuss about where we can measure or feel the pulses in our body. So before going into the details of the sites where we can feel these pulsations, let us first quickly discuss what is a pulse. It is simply a rhythmical throbbing that is felt over the arteries as blood is propelled through them. Still confused? In simple words, a pulse is just a tapping sensation that is felt over the arteries when we place our fingers over them. And also, why are these felt only on the arteries, not the veins or the capillaries? Actually, they are felt over the arteries by the reason that they are high pressure vessels, unlike veins or capillaries, which are low pressure vessels. Now, where will we feel these pulsations? They will be felt on all these 9 areas written on your screen, named as carotid, radial, brachial, temporal, abdominal, femoral, popliteal, posterior tibial, and dorsalis pedis. Now let's locate one by one in this illustration all the pulsations in our body. First is the temporal pulsation that is felt on the temporal bone of the skull. Second is the carotid pulsation that is felt on both the sides of the neck. The brachial pulsations are felt on the upper arm near the elbow joint. The radial pulsations are felt near the wrist joint. The abdominal pulsations are felt above the umbilicus laterally. The femoral pulsations are felt on the upper leg near the symphysis pubis. The popliteal pulsations are felt behind or the posterior surface of the knee joint. The posterior tibial pulsation and the dorsalis pedis pulsation are both felt on the lower leg. Okay, so thank you for watching till the end. If you have any queries, you can ask them in the comment section and I'll get back to you as soon as possible. Thank you.